My name is Mike Mawby. I'm the program coordinator for the Safe and Together program here in Highland. And today I've been asked to talk to you a bit about the approach that we have taken here in Highland to Safe and Together. We are a DES-funded program, and I'll talk later on about some of the benefits that we've found of being part of the DES program as we sought to implement Safe and Together here in Highland. Brief bit about me. I'm a social worker by training, and as I was preparing for this presentation, I realised that this year will mark my 30th year as a qualified social worker, which is terrifying. In that time, I've worked across various services and agencies, both statutory and third sector, ranging from adult criminal justice through to early years, children and families, and child protection. And in all those spheres, domestic abuse has been a feature of the work that I have been undertaking in that time, and I've had the opportunity to work both with perpetrators, adult survivors, and children and young people affected by domestic abuse. I've been in my current post since October of 2022. As I said, we are one of the 12 DES-funded areas here in Scotland. And prior to me coming into post, the approach that Highland decided to take way back in the day when they were considering putting in a bid was to building on our experience with GERFEC to take a multi-agency approach. So you will see from the logos on the slide here, this has been an approach that has been led by the Violence Against Women Partnership and the Child Protection Committee. So it's a priority for both of those areas, and it was a bid prepared and submitted on behalf of both of those partnerships, both of those services here in Highland, and we have sought to maintain that interagency approach since me coming into post. So what that has meant at the strategic level is that our oversight sits jointly, as I said, with the Child Protection Committee and the Violence Against Women Partnership, and through them reports to the Chief Officer Group here in Highland. Safe and Together is now a standing item on the agendas of both the Child Protection Committee and the Violence Against Women Partnership. So I'm required each quarter to prepare a report to both of those bodies and to be available to answer questions on the approach of Safe and Together. The key benefit to me of that has been the access to senior managers within the interagency partnerships and to get their support, and also through them to be able to have contact with the Chief Officer Group. So if there are issues that need to be addressed at a senior management level, we can do that. Drilling down a bit, so from that, we have on an operational, so on a day-to-day basis, oversight is led by our steering group, and hopefully you can see that what we have been very successful here in Highland is recruiting to that steering group the broadest possible representation across all the agencies and services here in Highland, and that has been invaluable to me as programme coordinator to get that input from the different agencies and services here. Originally, our proposal had been that we would concentrate the rollout under the DES funding on 5 key agencies and services, and they would be social work, both children and families, and criminal justice, police, colleagues in the public protection unit, colleagues from women's aid, child protection leads within education, and midwifery and health visiting services. And the rationale for that was that we would be focusing on those practitioners who would be either lead professionals, named persons, or likely to be making significant contributions to children's well-being through the child's plan process, partners to the plan in effect. So that was our original remit and focus, and I'll talk about the response to that. But we've also, through the steering group, been challenged on that, and colleagues, particularly in adult social care, have made strong arguments for us extended the remit to including them. Similarly, our colleagues from the Rape and Abuse Service here in Highland, and we've also been picked up on the importance of including colleagues from the likes of housing, youth services, etc. So whilst on the one hand, the membership of the steering group are really supportive and helpful, they're not afraid to challenge, they're not afraid to question why we're taking the particular approach. And it's really good to have such a broad swathe of representation and access to their expertise and experience on the ground. So since coming into post, we have run 6 core programs. And one of the things that we're very pleased about is the participation and engagement levels. So that had a potential capacity of 120 personnel on that, and we've had 110 successfully complete the program. So we've managed to avoid dropout rates, which I know has been an experience elsewhere. We have managed to maintain a multi-agency spread of participation on that, and we've had on all 6 programs good representation from across all of the agencies and services mentioned. But obviously the bulk of the attendees, the bulk of the participants have come from social work, unsurprisingly, but it has been felt to be of benefit to all of the other agencies. So from the programs that we've run today, here's a snapshot of some of the responses that we've had to the program, and these have been collated in the main through the post-course survey that the Safe and Together Institute run. And I've taken some extracts from some of the comments that people have made and tried to reflect the different agencies. That one of the encouraging things is the beginning of the change in the use of language. So people are recognizing things like the importance of perpetrator patterns of behavior, the importance of partnering with adult survivors. So people are beginning to internalize the learning from the programs and using the language. And I think one of the other big positives from it has been the appreciation folk have had of the ability to take part in interagency training and to learn from colleagues from other agencies, other services, and that has been very widely welcomed and is one of the encouraging things to see in the programs as they run. People coming back from breakout rooms, talking and expressing what they have learned from the colleagues on the program. But in true transparency, it's not been all positive. We have to acknowledge and we have to learn from some of the less positive, more negative aspects of it. And they have tended to fall into 3 particular categories. First, which will be of no surprise to any of you, has been the demands on time, capacity issues. This is a lengthy program, the equivalent of full days of training. As we all know, colleagues on the front line are stretched to near breaking point. The opportunity or the ability to take 4 days out of their working week to take part in training of this nature is a real strain on them. So I've been very sensitive to that and tried to accommodate that as best I can and reflect that in a training. So, you know, we do need to reflect on that. We do need to acknowledge that this is a huge resource and potential drain on resources. Again, the second element of the training that people have found, particularly given the nature and the subject matter of the training, is that lots of people have felt that the online training is difficult to engage with, both in terms of being able to fully participate, but also just being able to assimilate the information and the material and to make the connections that they felt able to do so. And also the nature of the material itself. I have sat in on every program that we have delivered here, and at times that has meant me participating in terms of offering an interpretation to some of the material that from the Institute, trying to put it in a Highland context, trying to show how it links to existing and other practices and policies, and try to highlight things like the links to GERFEC, the Shinari wellbeing indicators, how this links with our work to be better trauma informed, how it can support our commitment to things like the promise, but also on a practical level, trying to highlight and signpost people to who they might go to for additional help and support, how they might contact other resources and services. So that's been really insightful in terms of trying to translate this into a Scottish and into a Highland context. And again, it's one of the things that, we have sought to take on board from the feedback that we've had to date. From steering group operational standpoint, this is probably the big learning that we've taken from all the feedback to date, that really what this offers us, or should offer us, is the opportunity to do locality training. Coming out of the pandemic, one of the key strategic areas across the partnerships here in Highland has been a desire to rebuild and re-establish the interagency connections. Here in Highland, we've always prided ourselves on being good at working together across different agencies and services. And some of that is a necessity. If you're working in remote and rural locations, you kind of have to work well together in order to improve outcomes for children and families. But obviously the pandemic put a real strain and a test to all of that, and there have been significant changes in personnel across all services and all agencies. So it's felt that, and we are keen to look at opportunities to bring services together in localities to re-establish relationships. And again, through the steering group, we began to look at Safe and Together as being an opportunity to contribute to that ambition, that wider ambition that we have here in Highland to get back to a more integrated, cooperative approach to working with children and families. So what next, based on all of that learning and the experience since October 2022? So we decided that if we were properly to embed and implement Safe and Together here in Highland, one of the things that we needed was Highland-based trainers. So in December of last year, I completed the Training for Trainer program. So I am now in a position to be able to deliver core training alongside the overview and workshops presenting on the Safe and Together model. And that we are hoping is going to make a significant difference. So the big thing is that we are going to run 4 locality in-person core programs over the course of the next year. And we're looking to have 2 run in Inverness, 1 in Caithness and 1 in Loch Harbour. And again, those will be offered on the same basis as previously, interagency. And we've already had clear indication and enthusiasm for that. Folk are very keen to get together physically in a room with colleagues from other agencies and other services. as I'm sure you'll all know, a lot of that kind of relationship building, a lot of that interagency cooperation happens at the tea breaks and at the lunch breaks. It's that relationship building that we want to be able to have Safe and Together contribute to, in addition to the embedding the model in practice across as broad a swath of agencies and services that we can. We're not moving completely away from online programs, so we may look at delivering an online program at some point in the next 12 months. And one of the motivations for that is, again, just the remote and rural nature of the Highlands and the ability for people, even in localities like Lochaber and Caithness, to get to a central location. You can still be travelling significant distances. In addition to which, I have started to offer out short workshops to colleagues in other services, and I've already had interest from colleagues in Highland, well, particularly working with sports coaches to highlight the model to them, colleagues from Scottish Prison Service. We are also embarking on a comprehensive evaluation process in partnership with the Institute and with the Improvement Service. We've started that. At time of recording, there is a staff survey that has gone out to as wide as possible potential of personnel and that will provide our benchmark, our starting point, with a plan to do things like case reviews and more detailed drilling into how the model is being implemented and whether or not we can demonstrate it being embedded into practice. And crucially, Safe and Together isn't a one-off event, so working with the steering group and with the support of the Child Protection Committee and of the Violence Against Women Partnership, feeding up to the Chief Officer Group, is to develop a sustainability plan over the next year. So at the end of the funding from DES, look at how we can take this forward, what are going to be the demands on Safe and Together in terms of new staff and continuing the training program, but also how we can support staff going forward in the implementation of the model and embedding it into their day-to-day practice. So that's a very brief run through of our experience in Highland.